Hello. If you're dealing with the frustration of nail fungus or onychomycosis, this video is your guide to safe, effective home management strategies. We'll focus on alternatives because we want to help you achieve results without the potential risks of prescription pills, like liver strain. Our comprehensive approach is designed to work for mild cases or as strong support for professional treatments. Just remember, the slow growth of toenails means this journey requires patience. Expect 6 to 12 months of daily effort. Before you apply a single remedy, this is your most important step: get a professional diagnosis. Treating a condition that isn't fungus, like psoriasis or trauma, will never work. These conditions often look identical to an infection. Visit a specialist and ask for a nail clipping test. This simple procedure confirms if fungus is present, what type it is, and ensures you're treating the right problem. The biggest hurdle to success is the physical thickness of the nail. This plate acts like armor for the fungus. Your primary job is to break through this armor. This process, called debridement, is the most important step for getting medicine to the nail bed. You must thin the nail by trimming it short and gently filing the thickest parts. As a strict rule, sterilize your files and clippers with alcohol-based sanitizer immediately after use to avoid reinfecting yourself or family members. You might be wondering why treating fungus is so difficult. It's often because the fungi create a sticky, invisible fortress called a biofilm. This layer acts like a shield, making the fungus resistant to almost everything you put on it. The best way to combat biofilms is through physical removal. That's why thinning the nail is so vital. By removing layers of the nail, you expose the biofilm so that your topical treatments have a chance to work. The vinegar soak is our first strategy, supported by moderate evidence, as it leverages acidity. Vinegar's acetic acid content makes the environment hostile to fungi. We recommend using readily available 5% white vinegar for predictable strength. Use 1 part vinegar mixed with 2 to 3 parts warm water and soak your foot daily for 15 to 20 minutes. The most critical step here is the drying process. Use a clean towel or even a hairdryer on a cool setting to ensure every bit of moisture is gone. Baking soda is a safe, supportive strategy, mainly targeting the environment. It acts as a pH controller, creating an alkaline environment that most dermatophytes find difficult to survive in. More importantly, it is an excellent moisture absorber. Make it a daily habit to sprinkle 1 to 2 teaspoons into your socks and shoes. This simple action helps maintain the dry conditions that fungus hates. You can also incorporate it into a short 10 to 15 minute foot soak a couple of times a week. These tools provide essential support. Alcohol-based hand sanitizer is your hygiene aid. It kills spores on the surface of your nails and on your tools, but its rapid evaporation means it can't treat the deep infection. Use it sparingly once a day. Sea salt soaks are an older remedy that may inhibit growth by drawing moisture out of fungal cells. Both are considered weak evidence as standalone treatments, but they are great for supporting overall hygiene. Tea tree oil, or TTO, is a popular natural antifungal with moderate evidence for treating mild cases. Be aware that the successful clinical studies often use the full 100% strength of the oil. However, this strength poses a high risk of causing a painful rash or allergic reaction on the skin around your nail. For safe home use, you must dilute 1 to 2 drops of the pure TTO with a stable carrier oil, like coconut oil, before applying it to your nail. Safety is not optional. Always perform a patch test with potent remedies like vinegar and tea tree oil by applying a small, diluted amount to your inner forearm and waiting 24 hours. If you see redness or feel stinging, stop or dilute it more. The most critical safety rule for combination therapy is, do not layer multiple home remedies at the same time. Using vinegar, then TTO, then hand sanitizer, all at once, can seriously irritate the skin or lead to unintended chemical reactions. Combining treatments is often the key to success because it hits the fungus from multiple angles. A good enhanced routine starts with the 15-minute vinegar soak to acidify the nail. After drying, apply a surface cleaner like hand sanitizer, and follow that with your primary topical treatment, like diluted TTO or a prescription cream. Always pair this with daily shoe disinfection using baking soda or sprays. Take photos regularly, that's the best way to see the slow, but steady, progress. This is a critical safety warning. If you are using a prescription cream like cycloperox or efinaconazole, you must consult your doctor before using home remedies like vinegar or alcohol. These remedies can chemically alter the nail, which may increase the amount of prescription drug absorbed into your system. This enhanced absorption can significantly raise the risk of localized irritation, redness, or other side effects from the prescription medication itself. Never combine these treatments without medical approval. Long-term success relies 50% on hygiene. Your shoes and socks are breeding grounds for spores. You must rotate your shoes so that each pair has a full 24 hours to dry completely between wears. Change your socks daily, and use antifungal sprays or alcohol-based sanitizer to disinfect your insoles once a week. Finally, avoid painting your nails with occlusive nail polish during treatment, as this traps heat and moisture, which is the perfect environment for fungus to thrive. If your nails are extremely thick, one of the best advanced strategies you can use at home is a high-concentration 40% urea cream. This cream is designed to chemically soften and thin the nail, effectively debriding it without cutting. Apply it nightly, strictly to the nail plate only, and cover it with plastic wrap to help it penetrate. The most important safety tip: apply a thick barrier like petroleum jelly to the skin around your nail first to protect it from irritation or burns. If you are consistent for several months and see no progress, it's time to seek professional intervention beyond home care. A podiatrist can perform mechanical debridement, physically removing the infected nail and the tough biofilms. You can also discuss laser therapy, a non-invasive option that targets the fungus with heat. Finally, ask your doctor about the newer, highly penetrating topical medications or custom-made compounded creams. Let's review your success checklist. 1. Confirm your diagnosis. Never treat what you haven't tested. 2. Thin the nail. This is non-negotiable for penetration. 3. Be consistent. Daily treatment is required for up to a year. 4. Prioritize safety. Always dilute, patch test, and talk to your doctor about mixing remedies with prescription drugs. If you have diabetes or poor circulation, please seek immediate professional care for any pain or swelling. Thank you for watching and taking control of your nail health. References: